When patients have crowded, misaligned teeth, a lot of times they're coming in not necessarily looking for veneers, but just looking for options to fix it. And so there are really two options. One is we use orthodontics, and in my office we use Invisalign, and we go through the process of wearing those Invisalign trays. Each one's built a little bit differently, and then over the course of however many months we need, we're able to move those teeth back into the right position. That's I think, a really great option for your younger patients. A lot of times the issue is on my older patients, their teeth have been crowded for so long or out of position for so long. One, moving them is more challenging. Keeping them from reverting back to where they were is more challenging because teeth kind of have a memory. And two, they usually have uneven wear. So even if we straighten the teeth out, they're still going to be very uneven because of the way that they've worn and the bad position they were in. And so, the other option, one that I use more commonly, is going to be the porcelain veneers. And so with the veneers, I do what's called an additive reductive technique where I'm building out where the teeth are deficient, bringing back where they're overextended beyond the arch form, and doing what I call instant orthodontics. So with that veneering process, and you can see a lot of cases like that on my website, on my Instagram, I'm able to straighten the teeth out, all based on how I designed the smile and the veneering process, which my patients love that instead of going through a year of Invisalign, they're done in 2 visits over the course of a couple weeks. There are cases where, the upper teeth are chipped, worn down, we have color issues, and the lower teeth are out of position or crowded. And sometimes what we'll do is a combination of Invisalign and veneers. So maybe we'll veneer the upper teeth that they see more in the smile, and then we'll use Invisalign to straighten the lower teeth out, do some whitening, and in some cases that's enough. That's enough, and that gets the job done. So it really depends on the situation, the individual, and what we're trying to accomplish. To make teeth that are crowded look aligned with veneers, we use like different levels of thickness of the porcelain to balance the sizes of the teeth. And so where a tooth is back further, we'll add a little bit of volume. Where a tooth is further out, we'll make that veneer thinner. And in the end, by adding different layers and different thicknesses of porcelain, we're giving an end result that everything looks straight, right? We've lined up everything in the arch form, and we've done it instantly, which is kind of cool. The biggest misconception when we're using veneers on crooked teeth is, one, we can't do it, which is not true. We absolutely can. And two, we'd have to grind the teeth down a lot to do it. Also not true. We can do it in a very conservative way. And again, it's just by balancing and adding and subtracting where we need to. And when I meet with patients that have these teeth that are crowded, and I'm having that conversation, I'm able to tell them, hey, this tooth in particular, I'm going to have to be, grind a little bit more, remove a little bit more tooth structure on than normal. Are we okay with that? And then together we can decide, is this the right thing, or should we really consider doing some orthodontics first?